සුබ දවසක්. අද මම කතා කරන්නේ human skeleton system එකේ තියෙන skull කියන කොටස. The human skeleton. The human skeleton divided into two main parts. The axial skeleton that consists of skull, vertebral column, sternum and ribs. Then the appendicular skeleton that include pectoral and pelvic girdles and the limb bones. Again, the axial skeletal include skull, vertebral column, sternum, ribs. Then the appendicular skeleton include pectoral and pelvic girdle and limb bones. This is the picture you can see in yellow color. That is the axial skeletal system. Skull, sternum, vertebral column and ribs. The skull rests on the upper end of the vertebral column. Skull include 22 bones and connect together by ossified joint called sutures. These are ossified joint, they are called sutures. And the skull divided into two parts, cranium, face. Divided into two parts, cranium, face. This is the picture of a skull. You can see various bones and various parts. This is again frontal view of skull. Cranium. Cranium consists of frontal bone, only one frontal bone. Then the two parietal bones. Then the one occipital bone, then the two temporal bones, then the one ethmoid bone, and one sphenoid bone. Again, cranium consists of frontal bone, only one frontal bone, then the two parietal bones, then the one occipital bone, then the two temporal bones, one ethmoid bone, one sphenoid bones. You can see the picture of skull. When we see above the skull, you can see the frontal bone, you can see the parietal bones. You can see the sutures, suture line. These are the ossified joint. That I mark with red. It is this suture we called coronal suture. That I mark with green color. It is sagittal suture. These are ossified joints. Again, you can see, when you see behind the skull, you can see the sagittal suture, and again another suture that I mark with the green color. It is rhomboid suture. The junction at sagittal suture and the rhomboid suture, the area we call lambda. Again, you can see the picture. This is a coronal suture, and you can see the frontal bone in the green color. You can see the parietal bone in yellow color, and in the dark yellow color you can see the temporal bone, and you can also see the lambdoidal suture, and below that you can see the occipital bone in green color, and you can see the facial bones also. This is again a view of the skull inside. This is again cut section of the skull. You can see. Let's discuss the face. Face consists of frontal bone and 14 other bones. Frontal bone and 14 other bones. Two zygomatic bones. These cheek bones. And then they fused two maxilla. There are two maxilla, they fused and form the upper jaw. This is the upper jaw bone. Then the two nasal bones. There are two nasal bones, and the two lacrimal bones. Then the vomer, the one vomer. Then the two palatine bones, two inferior conchae. Then the two mandibles. These two mandibles fused and form the lower jaw. Two mandible fuse and form the lower jaw. You can see the picture again. This is a picture of the frontal view of the skull. You can see the frontal bone, you can see the facial bone, you can see nasal bones, two nasal bones, the vomer, one vomer, and the inferior nasal conchae. You can see the maxilla. There are two maxillae fused form the upper jaw, and you can see the mandible that form the lower jaw. You can see this is a picture of the temporal bone. Temporal bone, lateral view. Temporal bone belongs to the cranium. In the temporal bone, you can see the mastoid process and the styloid process and the zygomatic process. And this blue area, you can see this is the site of temporomandibular joint. Let's take the cranium. The cranium is capacity nearly 1.5 liters. 1.5 liters. This will ask in the exam. And the cranium protect and the enclose the brain. Cranium protect and the enclose the brain. And also protect inner and middle ear, olfactory organs, eyes. So cranium protect the brain and also protect the inner ear and middle ear, olfactory organs and eyes. That provide bony eye socket for eye muscle attachment. On the inferior surface, there's a big hole. We call that foramen magnum. Foramen magnum. That provide passage to the spinal cord. It's a big hole, big hole. That is called foramen magnum. On either side of the foramen magnum, two smooth round knobs. They are called occipital condyles. Occipital condyles that articulate with the first cervical vertebrae, atlas, and that permit nodding movement. This is you can see the occipital bone inferior view, viewed from the below. You can see the foramen magnum, a big hole that provide passage for spinal cord. And either side you can see the blue area. This is the condyles for articulation with the atlas vertebrae, condylar processes. And then there's a structure called fontanella. They are soft membranous regions. They are present at birth. Anterior Fontanella, this is the area, junction, and coronal and sagittal sutures. Coronal and sagittal sutures, this area we called anterior Fontanella. The size is around 2 centimeters. That close normally between 3 months to 2 years of age. Then the posterior Fontanella. Posterior Fontanella at the junction of lambdoidal and sagittal sutures. It's around 2.5 to 0.7 centimeters. And that close normally by the age of 2 months. By the age of 2 months. Fontanellas. Just remember these things. Then you can see the Fontanella pictures. You can see the size. And then let's talk about these sinuses. What are the sinuses? Sinuses are air-filled cavities. They are air-filled cavities. This cavity is lined by the ciliated mucous membrane. Lined by ciliated mucous membrane. And the sinuses present in sphenoid bone, ethmoid bone, maxillary bone, frontal bones. What are the bones that contain sinuses? They are sphenoid bone, ethmoid bone, maxillary bone, and frontal bone. This will definitely ask in the exam. So you should remember these bones. And then they are communicate with nasal cavity. They are communicate with the nasal cavity. What are the function of these sinuses? They provide resonance to voice And because of these sinuses, the weight of his skull is reduced. So it is important balance of the skull on atlas. Let's talk about the facial region. Facial region, that is a region below the cranium. Some facial bone form the posterior part of nasal cavity. Some facial bone form the upper part of air passage. Maxilla and mandible provide ridges for the teeth. Maxilla fused with the cranium. Mandible is movable. Maxilla fused with cranium. Mandible is movable. Hard palate, that is bony, and the soft palate, that is cartilaginous, separate the buccal cavity from the nasal cavity. This is the picture of mandible. You can see various processes, coronoid process, and you can see the head, and there's a notch, a mandibular notch. There's a process called condylar process. This is again the picture. You can see the zygomatic bone, zygomatic arch, and styloid process of temporal bone. You can see the nasal bone view laterally of the right nasal cavity. This is the sphenate bone. It's just like a bat or a butterfly. So it's called sphenoid bone. There are lesser wings and greater wings, and detail of this bone is not necessary. And this is the mandible. This is the left mandible. You can see the coronoid process. You can see the area, the condyle process, the area marked with the blue color articular surface for temporomandibular joint. Let's talk about the facial region. Facial region, the lower jaw articulated with the cranium. The zygomatic arch. The zygomatic arch formed by part of zygomatic bone and temporal bone. Provide surface for lower jaw muscles. What are the bones that form the zygomatic arch? What are the bones? They are zygomatic bone, part of zygomatic bone, and temporal bone. Zygomatic bone and temporal bone that form the zygomatic arch. This will ask in the exam. Then the condylar process. Condylar process articulated with the temporal bone. Condylar process articulated with temporal bone and form the temporomandibular joint. This should be remembered. And the coronoid process that give attachment to the muscle and the ligaments. This is a picture. You can see then the anterior base of the skull on occipital bone, two occipital condyles present as I described earlier. This form hinge joint with the atlas that permit nodding movement. You can see these condyle processes. Then the temporal bone. Temporal bone contain three processes. Zygomatic process that form the part of zygomatic arch. Then the mastoid process and the styloid process. These processes provide surfaces for muscle attachment. You can see the part of the view of the temporal bone. You can see the mastoid process. You can see the mastoid part and mastoid process and styloid process. This blue area is the site for temporomandibular joint. Also you can see the process, zygomatic process, the part of zygomatic process. And let's take MCQ. It is from the 2020 August MCQ, 13th MCQ. In the skull, in the human skull, warmer contributes to form the cranium. It is false because warmer contributes to form the face, not cranium. Then the ethmoid and sphenoid bones are basal bones. It is false because ethmoid and sphenoid bones are cranial bones. Then the zygomatic and parietal bones contribute to form zygomatic arch. It is false because a zygomatic arch is formed by the zygomatic bone and temporal bone, not the parietal bone. Then the mastoid process of mandible articulate with temporal bone. Mastoid process of mandible articulate with temporal bone is false because not the mastoid process articulate with the temporal bone. Then the last one, maxillary and frontal bones contain sinuses. That is the true answer. What are the other bones that contain sinuses? Sphenoid and ethmoid bones. Yes. Let's discuss another MCQ. It is from 22 August 46 MCQ in new syllabus. Yes, this is from the vertebral column. I will discuss this in my next lecture. And thank you very much. And have a nice day. Study hard.